The project I'm working on is improving how general pediatricians can disclose newborn screening results for Krabbe disease. Pennsylvania is one of the few states that currently include Krabbe disease on their newborn screen so that infants can be connected to appropriate treatment as quickly as possible. However, families have expressed concerns in the past that the process of receiving results is somewhat challenging, that there might be difficulties with communication, difficulties in understanding what is meant, and pediatricians as well have expressed that particularly due to limited understanding of rare diseases, this is something they struggle with as well. So my project is to develop an intervention to make this process as smooth and as seamless as possible for families in what could otherwise be a very challenging time. I heard about it from my colleague, Dr. Deepa Rajan, who heads the Children's Center for Neurogenomics at UPMC Children's Hospital of Pittsburgh. She had informed me about the RFRF and thought that this grant program would be a good fit for my research interests. Working at UPMC Children's Hospital of Pittsburgh, where I had done all of my residency training and fellowship and had remained as a faculty member, in this institution, rare diseases are relatively common. We serve a huge catchment area, and so everyone within our area who needs to see a specialist comes here. So I was in a position to encounter many children with rare neurogenetic diseases, including Krabbe disease, in the course of my medical training. And I got particularly interested in diagnosis, communication with these families, how to explain, what's going on when you find out that your child has a disease that you've never heard of before that has potentially life-changing ramifications. So that's really how I got interested in the field of rare diseases and Krabbe disease. In particular, I'm inspired by the resilience of the patients and families I've encountered, and particularly how families with these conditions find each other and manage to support each other in developing certain communities. And I really wanted to be part of that and be able to support these families in their journeys. I think there's a lot of promise in newborn screening for conditions like Krabbe disease in terms of being able to connect patients and families to appropriate treatments and to know what to expect and to ensure, the highest possible quantity and quality of life. My research is really about making that newborn screen result disclosure process as easy and as straightforward as possible so that families can connect to the care that they need and kind of understand what the next steps are. I think that's an inherently hopeful mission. The best parts of my job are twofold. On the one hand, as a clinician, I really enjoy interacting with individual patients and families and being part of the process of treating the child and ensuring the best possible life for the child. On the other hand, as a researcher, I really like being able to engage with the big picture, like being able to help kind of families in aggregate through the health systems interventions that I'm developing and testing as part of my work. So in terms of the most challenging aspects of my job, being a pediatric neurologist means that sometimes I encounter children with life-limiting illnesses who pass away or become significantly disabled. And observing that can be challenging, but it's nevertheless very rewarding to be able to help that patient have the best possible quality of life and to be able to support their family through that situation. In addition, being a clinician involves a lot of bureaucratic annoyances like writing notes and stuff, but I will not belabor talking about that. My advice would be to do it. It would be to jump right in. In terms of how to do it and how to get started, I think connecting with an institution with a strong program in rare diseases is important because you need to be where the patients and families are. Like as I mentioned earlier, I had the fortune to do my training and to be a faculty member at an institution that serves a lot of these patients and families. And connecting with such an institution will also help you find the right mentors, people who are already working in this area and have a lot of expertise in this area, who can help you learn how to do research. And most importantly, talking to the families and meeting the patients is the most important thing you can do, because kind of seeing, who you're going to be helping and who you're going to be working with is really the most rewarding part of the job. I figured out as a resident, probably later than I should have, that the families of patients with rare diseases are really the people with all the expertise, not me and not even the physicians who are more experienced than me. Every child with a medical condition is entirely unique, and really the families know how to best help them. So listening to the families, partnering with them, developing plans with them in collaboration with them is likely the best way to provide medical care to those families. I enjoy spending time with my husband Thomas and our dog Cruiser, who's a big white fluffy Samoyed. We enjoy traveling. We're going to France later this year, and we also like watching horror movies.